January is Cervical Cancer Awareness Month. More than 13,000 women are expected to be diagnosed with the disease this year. So joining us now is Dr. Allison Staley with Rocky Mountain Gynecologic Oncology. Dr. Staley, thank you so much for joining us.
Thank you so much for having me. I do appreciate the opportunity.
Such an important topic to discuss. Who is most frequently diagnosed with cervical cancer?
Yeah, as you said, 13,000 women in recent years are actually diagnosed with cervical cancer, and 4,000 women will ultimately die from this disease each year. And the people who are most at risk for this are folks who have not been vaccinated with the HPV vaccine, smokers, and women who have immunologic diseases that result in them having a decreased immune system.
You know, cervical cancer, I feel, used to be one of the most common causes of cancer death in women, but we're hearing the rate has actually dropped fairly significantly. Is it because of some of the things you just mentioned, because of modern technology and medical science, or what is your opinion on that?
Yeah, absolutely. So in recent years, since 2006, actually, we've had the HPV vaccine available to the public. And with the utilization of the vaccine, we have seen decreased numbers. But unfortunately, we have the opportunity to truly eradicate this disease, but yet we are still seeing 13,000 women each year being diagnosed with it. And where we need to focus is getting every eligible person vaccinated so that we can truly decrease this disease risk and the prevalence of it.
You know, sometimes women tend to push these doctor appointments off because they put others before themselves, or they think, yeah, I don't have time for this. But things like the pap smear are so important for prevention. How does the HPV vaccine also help?
Yeah. So the HPV vaccine will not only help with cervical cancer, which is an HPV mediated cancer, but will help with others. It'll help with certain ear, nose, and throat cancers, penile cancers, anal cancers, vaginal and vulvar cancers as well. And the people who need to receive this vaccine are actually children. So boys and girls, according to the CDC, need to be receiving this vaccine between the ages of 11 and 12 in order to have the best efficacy over a long period of time, their entire lifetime, as well as to have them vaccinated before they're ever exposed to any of the strains of HPV.
Are you seeing a certain type of age group that maybe is predisposed to this type of cancer, or does it happen to anybody?
Unfortunately, HPV is ubiquitous within society. So you're going to see young mothers all the way up to our seniors who are affected by this. Every race, socioeconomic class, and belief system, really. 85% of American adults will be exposed and infected with at least one strain of HPV in their lifetime. And in fact, at any given time, 50% of Americans will be infected with a strain of this virus.
That is stunning. Is there anything else that you want women to know about cervical cancer? Maybe something we haven't touched upon yet that we need to get the word out on?
Absolutely. So the first is vaccinate your children, vaccinate them early. There's a very safe vaccine, Gardasil 9, that has been on market and has been tried and true in terms of efficacy as well as minimal side effects. The other thing is to stop smoking. Tobacco use is actually another big risk factor for HPV progressing onto cervical cancer. So smoking cessation is important in so many ways, including that. And the other is, yes, get pap smears, get your screening done. Pap smears need to begin at the age of 21 years old. So women need to start seeing gynecologists if they haven't already to start that screening process. And make sure they ask questions. You need to ask your doctor, did I get screened? What were the results? What does that mean? And how frequently do you need to return for screening so that you're protecting yourself going forward?
I appreciate how we're speaking directly to women, but is there anything men should know?
Yeah, absolutely. As we talked about, young boys also qualify for this vaccination, and they should receive it, once again, between the ages of 11 and 12. And so fathers need to be encouraging their sons to receive this. One thing I do want to highlight to everybody is that the HPV vaccine is actually not a mandatory vaccine with the normal series that children receive. In fact, only a few jurisdictions and states within the U.S. actually make that mandatory. And so in the state of Colorado, you have to opt in order to get that vaccine. And so parents need to be making sure that their doctors are providing that for their children at the right time.
Thank you so much for spreading awareness on this, Dr. Staley.
Yes, well, we really appreciate the opportunity. Thank you so much.
Thank you for joining us, and we just want to let everybody know, if you'd like to learn more, for more information, all you have to do is just head to our website, cbsdenver.com. You'll find all the details there.